Let you know when it's broadcasting. Okay, you're live.
Welcome everyone to this very special annual celebration of the Commonwealth Tribute to Life project. It's 13th of March 2023, and it's fantastic to join you all. I would just like to, we're live. I'll start again in case we're live. If it's ever go on mute. Welcome everyone to this very special celebration of the Commonwealth Tribute to Life project. I'm Dale Gardner, intensive care doctor in Nottingham in the UK and the Associate Medical Director for Deceased Donation with NHS Blood and Transplant. We've got this very special YouTube where we're going to go over the next 2 hours with some wonderful guest speakers, and we're really going to want to share this initiative with you, what's been achieved, what we hope will achieved. But to launch us off and to give a formal welcome, I'm going to invite the person who's done more to get this project up and running than anyone else, is Dr. Satya Sharma, who's the current chair of our custodian board for the project. Satya, over to you just to give a formal welcome.
Thank you so very much, Dale. And I'm going to keep away from good morning because somewhere it's evening, somewhere it's afternoon. So like Australians say, good day to you, all of you. I hope you have a very worthwhile 2 hours conversation. I think it has probably to be said that this is a project like no other. And frankly, to participate in this project is not only a privilege, it's wonderful, it's an honor. Now we all need to be feeling very happy about this, because really speaking, this is a project where we'll be able to help each other. And in this project, what has happened so far is that a platform has been created, but the platform really depends upon the performers. The platform is firmed up, so the stage is set, but the more the performers, better it gets. We have had some good positive development so far. Singapore has done a bit, and you might hear a little bit more about that from Singapore. India has done quite a lot, and in India, we have lots of participations from Mohan Foundation and elsewhere, and you'll be able to hear that as well. In Malaysia, there has been a request to hear or to understand more about immunology. Somebody came and got trained as a result of this project. And those are the kind of things which will make this project very worthwhile. But what we still want is, we are hungry, and what we still want is more of these. But the real key issue is getting the ownership. The ownership does not rest with the UK. It does not. It rests with everyone. Each participant is equally important, equally happy, and equally valuable to make this project more successful. And frankly speaking, the more we do, better it gets for everybody. I'm not going to say a lot more, except that very warm welcome again. And I hope that these 2 hours are very worthwhile, your discussions. I'll chip in from time to time as the webinar progresses, but I'll speak to you at the end. Thank you, Dave.
Thank you very much, Satya, for that welcome. I'm just going to give us a little introduction to our first talk. So just let me share your screen. I share my screen and just confirm, Satya, that looks fine to you.
Yes, it does.
Fantastic. So as I said earlier, this is our annual celebration on Commonwealth Day, 13th of March, 2023. So the first thing to say is happy Commonwealth Day. I'm not sure how much you have celebrated Commonwealth Day previously. I wasn't really, I confess, aware of it. But actually every second Monday in March each year, so second Monday in March each year, is Commonwealth Day. And there was a Twitter from the Commonwealth today celebrating that, and there's some pictures of different flags. Although if you notice really carefully, although they've been using this picture, there are a few non-Commonwealth countries in that flags there that I spotted quite late in the piece. But nonetheless, it's a great celebration. But what are we celebrating? I think we're celebrating the fact that we inaugurated our Memorandum of Understanding among Commonwealth nations on the 22nd of July 2022, a week before the Commonwealth Games last year. Just to remind everyone what the purpose of this Memorandum of Understanding is to, through the sharing of knowledge and expertise, we will increase ethical organ and tissue donation and transplantation, regardless of transplant infrastructure, for the benefit of all Commonwealth citizens. So just to emphasize a few things here, it's a sharing of knowledge and expertise. That's what this is about. We just wanted to make sure connections and come together. We're going to increase ethical organ and tissue. So the tissues is an equally important transplantation. And we want to be something that's worthwhile for all Commonwealth countries, regardless of their healthcare size or other factors, and be a benefit for all Commonwealth citizens. That's the ambition you've all joined us on, and thank you very much for that. So what have we achieved? Well, as at the 22nd of July last year, we had 43 countries represented on the MOU, which was 80% of the Commonwealth nations. We had 18 supporting organisations, with 15 of them actually signing the Memorandum of Understanding. And that gave us coverage of around 98% of the Commonwealth population of 2.5 billion, which is just incredible. But what I really feel we did is we established the very first Commonwealth organ and tissue donation and transplantation community where we can all come together and share. So that's great. But since then, we've actually gone backwards, not because anyone's left the MOU, but the Commonwealth has added 2 new member countries. And so now there's 56 Commonwealth countries. And so our percent of coverage from 43 over 56 is now 77%. And so just a little welcome to 2 West African countries which have joined, with Gabon with 2.3 million. You can sort of see it on the screen over here. And Togo, which is 8.6 million, which you can sort of see over here. Both it's sort of a little bit east of Gabon. So welcome to those countries. This is where the representation we do have. 43 Commonwealth countries. So we're still missing 13 now, and we've got those 2 new ones. So if you have any contacts with some of those countries, please help us to join them, and that'll be an absolutely fantastic sort of opportunity. We appreciate some of these other countries we haven't reached are quite small, and maybe covering organisations may be helpful. We've got 18 supporting organisations, which you can sort of see here represented. So great. Welcome, Osahon. We just might get you on mute, and we'll get you on in a second. Thank you for joining. And that we're really grateful for all that work. What have we done in 2022? What were the initiatives the project succeeded? Well, the big 2 things we did was we actually launched the project on the 14th of March 2022, and then we led up to the inaugural ceremony. So we had 2 big ceremonies in the UK to mark and celebrate this initiative. We delivered those 20 world-class webinars. They're all on the, you can get them from the website. They're also on the YouTube. So please connect to them and watch them. They are really world-class. We've had our regional coordinators working together. We've connected different countries, like as an example, Namibia is connected to Pakistan through connectivity. And we actually ran a clinical attachment where someone from Malaysia, a doctor from Malaysia, came across and spent some time in the laboratory, the transplant laboratory in the UK. And so again, these sabbatical opportunities are something we could look out for and really sort of share that knowledge and expertise. When it comes to what we're going to do in 2023, well, we've got this special webinar that we delivered just over a week and a bit ago, which was actually at the joint BTS, British Transplantation Society, and NHSPT Congress. That was on March the 1st. And so please, if you are running a conference and there's an ability to share some of it, we only shared 1 session. We only streamed 1 session from a 3-day Congress. We called it the Commonwealth session. And that was an opportunity. So if you think of ways when you're out running your own conferences of actually streaming something for the benefit of all the Commonwealth, that will be really supporting the project and really emphasizing that sharing knowledge and expertise. The YouTube channel is getting stronger. We've got much more content on it. We've got those webinars, those world-class webinars. We've got something we're going to share later called Leave Them Certain videos, which I'd like you to enjoy. And we've also, of course, the annual celebration today. But it's only early in 2023, and we need a lot more connectivity to make this project grow. As Satya said, we want to take it beyond the initial UK home for it, and we want other people to be running things. And so, we can help advertise and share what you are doing, and any connections you're having through the project, please draw to our attention. With regard to how we're running going forward, we have some future structures to help grow the project. And they are essentially two groups. We've got the Commonwealth Tribute to Life Custodian Board and the Commonwealth Tribute to Life International Implementation Group. So just a little bit of explanation. The Custodian Board will be inspired a bit like by the Declaration of Istanbul Custodian Board. They act as custodians, guardians of the MOU. They're going to review it every 12 months to see how things are progressing and can advise on some of the agenda. We're very grateful that we have a patron in Baroness Finlay of Llandaff. She sits in the House of Lords in the UK and has been part of this project for the very beginning. We've got Dr. Satya Sharma is the chair. We've got Mr. Anthony Clarkson as Director of Organ and Tissue Donation and Transplantation. We're hoping Osahon will come on as the past president of the Commonwealth Medical Association. He's speaking soon, and he's been a great support from the very beginning. And we also have the 6 regional coordinators who will actually sort of be able to bring things together and have a big reach across these regions. Then we have the implementation group, and in many ways this is all of you, people who actually are representing their country or representing a supporting organization. We're the real workhorses to really sort of drive these things forward. It's got the 6 regional coordinators, one of whom will act as chair currently, that's me, all the countries represented, the supporting organization, and Keelan Jones has been very helpful in actually acting as project manager to drive things forward. So really just the last slide, the Commonwealth Tribute to Life, these are words very much that Satya has sort of said and sort of made his own, and I really want to echo them, that we need everyone in the room, everyone connecting virtually, a huge opportunity post-pandemic to use the virtual connectivity we have, and everyone in the Commonwealth acting as ambassadors for this project, spreading the message about sharing knowledge, sharing expertise to save lives in the Commonwealth. And that is my introduction on where we are at the project. And thank you for joining that, and thank you for what everyone's support has been. What we're going to do now is, after I've just delivered that, is I'm going to ask Satya just to please introduce our keynote speaker to us, if you can, Satya, and then we'll get the slides up and we'll talk. Thank you very much, Satya.
It is a pleasure to introduce Osahon Enabulele. Most of you would have known and heard him one way or other, but he has recently been the president of Commonwealth Medical Association, and he has passed that responsibility over to somebody else. But we wanted his contributions today because he has had most experience. He has done his stint for a while to be able to know about all the problems in the Commonwealth, and that may include transplantation as well. But he has now been elevated to World Medical Association President's post, and congratulations to Osahon. But really speaking, this is reflection on the well-deserved abilities that you have. And it's great pleasure to welcome you, Osahon, to this particular Commonwealth Tribute to Life celebration, where we are keen to listen to your keynote speech. So over to you, Osahon, and very warm welcome.
Thank you very much, Satya. Please accommodate my current location. I just finished from an embassy. But again, my commitment to this project has ensured that I found there's a comfortable place to speak to you. First, let me recognize all the dignitaries here today. I know several important persons have been invited to join in this annual celebration of the Commonwealth Tribute to Life. So I bring you greetings, and I say it was with utmost humility that I speak to you today at this auspicious occasion of the 2023 Commonwealth Tribute to Life annual celebration. As we well know, this is my first event of the Commonwealth Tribute to Life since my inauguration as president of the World Medical Association on Friday, October 7, 2022 in Berlin, Germany. I therefore wish to extend my profound gratitude and warm felicitations to the leadership and management board of the Commonwealth Tribute to Life, and most especially to Dr. Satya and Dave. I'm quite proud of the remarkable attainments made by the Commonwealth Tribute to Life since its establishment. Now, when I was first requested in 20 minutes a keynote speech today on healthcare challenges in the Commonwealth, I had wondered why the organizers chose such a theme and such a short time. I had wondered if there were still challenging issues in the Commonwealth, especially after the highly publicized, high-profile CHOGM meeting that took place in Kigali, Rwanda in the month of June last year, and which was expected to substantially resolve issues confronting the Commonwealth, including our healthcare challenges. However, from all available indications, it is obvious that despite efforts being made by Commonwealth countries, the Commonwealth Secretariats, and non-state actors, including the Commonwealth Tribute to Life, to attain the Sustainable Development Goals 2030 targets, the Commonwealth is still grappling with numerous, complex, and sometimes intractable healthcare challenges. But what are these healthcare challenges? Before I proceed to dwell on them, may I admit that it may be impossible to do real justice to them in just 20 minutes. I shall, however, try to deliver the essential ingredients within the allotted time. Now, to have a better appreciation of these challenges, it is also important to remind ourselves what health, healthcare, and health system actually mean. Now, any service geared towards the maintenance, restoration, and promotion of the health of individuals or patients is a healthcare service. Now, this could involve preventive, curative, promotive, or rehabilitative healthcare services. Now, when we talk about the health system, it's a set of elements consisting of the people, institutions, and resources, and their relationships, acting in an established order to provide healthcare services to the population they serve, and by so doing, improve the health of the population. Now, while I admit that health has been variously defined by various schools of thought, either in terms of the positive or negative model of health, the worldview and definition of health is still centered on the 7th April 1948 definition of health by the World Health Organization. Now, in the process of developing the preamble to its constitution, the World Health Organization defined health as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, while this definition seems to put a lot of responsibility for health on activities that occur in the health sector, it is necessary I state here that from a contextual and development point of view, health is not only affected by activities that take place within the health sector, but more importantly, by factors that have been classified as social determinants of health. This concept, which has received a lot of push from the World Health Organization, the World Medical Association, the Commonwealth Medical Association, and several other stakeholders, needs to be well understood by political leaders, stakeholders in the health sector, and members of the public, so as to appreciate the dynamics that influence the health of citizens and the health of nations. Social determinants of health is all about creating the right social, cultural, and physical environments that promote good health for all. According to the World Health Organization, the social determinants of health are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include socio-economic policies and political systems, development agenda, social norms, and attitudes, including discriminatory tendencies, racism, and distrust for governments. In specific terms, this will include issues of access to educational opportunities and quality of education, poverty and access to economic opportunities, job creation and opportunities, job training, job security, housing, nutrition and food security, as well as access to healthcare services. The renewed global focus on the social determinants of health raises a critical question of political commitment to health, particularly by political leaders in countries of the Commonwealth. Now, the implication of the above definitions is that any contemplated healthcare arrangement in the Commonwealth must be one that is inclusive, adaptive, efficient, effective, robust, and resilient, and meets present and future aspirations and expectations. This is a kind of healthcare arrangement that can secure the health and well-being of the people of the Commonwealth. The Commonwealth, like we know, is home to about 2.5 billion, about between 2.35 and 2.5 billion people, about a quarter of the global population, with about 94% of its people living in low and middle income countries of Asia and Africa combined. The Commonwealth is characterized by obvious health disparities and inequities, essentially resulting from weak health systems attributable to poor political commitment to health and poor health investments and public health funding, as well as what is now known as medical tourism in most countries of the Commonwealth. On account of this, most of the Commonwealth countries are yet to attain universal health coverage. This is seen in virtually all elements of the healthcare system, including inequitable geographic and financial access to quality care, human resource for health, essential drugs and medicines, and many more. Like you know, about 50% of the populations of Africa and Asia lack reliable access to essential quality medicines, health commodities, and vaccines. There is a burgeoning phenomenon of brain drain of physicians and other health professionals in the Commonwealth, resulting in acute and chronic shortages and inequity in distribution and burnout of the health workforce and poor health outcomes. This is made worse by the poor reward system and the rising incidence of violence against physicians and other health professionals in the Commonwealth of Nations. Commonwealth countries, like you know, share a high burden of non-communicable diseases, with nearly 400 million individuals in the Commonwealth currently diagnosed with at least one non-communicable disease, including various chronic diseases and cancers. Supporting care services, including transplantation services, are largely unavailable. The Commonwealth is estimated to account for 40% of cervical cancer incidence and 43% of cervical cancer deaths globally, with countries in the African region having the highest burden of cervical cancer. There is also the challenge of neglected tropical diseases, such as malaria and trachoma. Indeed, as of the year 2020, it was estimated that over 24 million people in the Commonwealth were at risk of trachoma, which is a leading infectious cause of blindness globally. There are, of course, other challenges, such as chaotic and weak supply chains, antimicrobial resistance, climate change crisis and its health implications, emerging and re-emerging diseases such as tuberculosis, and of course, lack of community ownership in most of the countries and stakeholder involvement. There's also weak digital infrastructure in most countries of the Commonwealth, in addition to inadequate investment in research, poverty, and poor management of social determinants of health. I dare say that while noticeable efforts were being made by some countries in the Commonwealth to address these challenges in the pre-pandemic era, in the pre-COVID pandemic era, the COVID-19 pandemic, which, like you all know, exposed the fragility and state of unpreparedness of most health systems in the Commonwealth and devastated lives and livelihoods, including the lives of many physicians and health professionals. May their precious souls continue to rest in perfect peace. Very unfortunately reversed some of these gains and worsened health disparities and inequities in the Commonwealth. However, to secure the health and well-being of the Commonwealth and our people, it is imperative to leverage on the abundant learning opportunities and lessons provided by the COVID-19 pandemic. One of such lessons is the urgent need to build more resilient health systems in the Commonwealth, with physician-led primary health care as its bulwark, in a way that advances access to care and helps to attain universal health coverage. This calls for good governance and a pro-political commitment to the health and well-being of Commonwealth citizens, backed by substantial and sustained investments in all the critical building blocks of the health system, including the health infrastructure, medicines, vaccines, the health workforce, and health management information systems. There is also need for governments in the countries of the Commonwealth to massively invest in research and local manufacture of health commodities, consumables, medicines, and vaccines, as well as preventive healthcare, including vaccination programs and public health education. It is in this light that the pandemic treaty, which member states of the World Health Organization are currently cogitating on, must be given critical attention with the views of all stakeholders duly incorporated, particularly as it concerns the integration of the health workforce in the frontline management of any future pandemics, as well as their resilience, well-being, and working conditions, amongst other important issues. Another important learning point is the fact that unless we seek an inclusive and equitable Commonwealth through sincere address of the staggering health inequities and inequalities across the Commonwealth, the health of the Commonwealth may remain at an unsatisfactory level. Inequities in prioritizing health challenges and issues, and in the sharing of resources, including health technologies and scientific developments, poor management of the social determinants of health, and neglect of tropical diseases have created opportunities for the resurgence of diseases that were once controlled in some countries. The vaccine nationalism and inequity that manifested itself during the COVID-19 pandemic left behind citizens of most of the developing countries of the Commonwealth. The outrage that trade this unfortunate inequity in resource allocation reinforced the saying that no one is safe until everyone is safe. However, I dare say that this saying must be reckoned with not only in words, but in action. The health disparities and inequities have affected the attainment of universal health coverage by most developing countries of the Commonwealth. It is therefore imperative to expand the frontiers of cooperation and solidarity amongst countries of the Commonwealth. The inequity in resource distribution, including health workforce distribution in the Commonwealth, particularly in the low and middle income countries, due to health workforce strategies from brain drain and burnout, needs to be urgently tackled and in a progressive manner. According to estimates by the World Health Organization, by the year 2030, the world will be in need of about 18 to 20 million more health workers. A lot of these deficits, unfortunately, are in the low middle income countries of the Commonwealth. How can the Commonwealth address this unfortunate inequitable situation? Through effective management of the push and pull factors, with governments on both sides of the divide made to adopt an ethical consensus in their approach to the management of human resource for health. How can governments, particularly in the low middle income countries, be made to invest more in the welfare, working and living conditions of physicians and other healthcare workers? Can the governments be taken into account in terms of their adherence to minimum benchmark expectations? Another important area that needs accelerated attention is the management of emerging and re-emerging infectious diseases and antimicrobial resistance, which has resulted in significant morbidities and mortalities. To address these challenges, the policy prescription on One Health, especially with the recent launch of the Joint Action Plan on One Health, must now be strengthened with effective translation into action. A major threat to the health of the Commonwealth is a climate crisis. There is now more than ever before an urgent need for countries in the Commonwealth to take decisive action to reduce the greenhouse gas emissions and other activities contributing to global warming. The climate crisis is contributing to increases in communicable and non-communicable diseases and other health implications. To secure the health of the Commonwealth, there is also need to responsibly address the challenges faced by medical education across the Commonwealth, as well as challenges posed by new and emerging health technologies, including augmented intelligence, digital technologies, and digital health, particularly as it concerns ethical and regulatory concerns, as well as equitable deployment of these technologies. Finally, beyond the rituals of the CHOGM meetings, the Commonwealth must find a way of tracking and interrogating governance systems in the Commonwealth, particularly the health system, and universal health coverage performance of the various countries in the Commonwealth. With a day of reckoning set aside, it must not be business as usual. I was in the last Chogon meeting, and with all due respect, it was like business as usual. In all of this, citizens' empowerment and engagement, as well as community ownership, must be given emphasis. May I briefly talk about the role of the Commonwealth Medical Association in resolving some of these healthcare challenges? And I will be very brief in this. The Commonwealth Medical Association, like you know, is an association that has been on for decades. The association has its own very laudable objectives. And in terms of resolving healthcare challenges, it has certain roles, including advancing leadership direction in terms of healthcare arrangements, and of course, formulating policies and initiatives. The Commonwealth Medical Association also can involve itself in public health education to ensure that there is a positive influence on health-seeking behavior of citizens of the Commonwealth in terms of their lifestyle practices and, of course, consumption of healthcare commodities. There's also room for Commonwealth Medical Association, and it has done so over the years, for advocacy for good governance and improved public health investments, as well as legal frameworks and legislations for health, as well as universal health coverage. There is more than ever before. This is a time for us to advance advocacy for universal health coverage, because that remains the key towards resolving a lot of the health disparities and inequities that we see in the Commonwealth. The Commonwealth Medical Association has a role in building coalitions and collaborations. And I'm very delighted to note that there is a strong collaboration going on between the Commonwealth Medical Association and the Commonwealth Tribute to Life. That is the way to go. There's also a role for it to attract the performance of health institutions and, of course, governments in the Commonwealth to ensure that they are meeting up with their health mandates. They also have a role involving itself in research, capacity building, and provision of quality healthcare services, as well as ensuring that the ethical and regulatory standards are maintained. In conclusion, I want to say that despite resolutions taken at various Chogon meetings, and there have been several, the Commonwealth still grapples with numerous healthcare challenges, with overall health and well-being of the Commonwealth and our people still less than satisfactory. However, the COVID-19 pandemic provided significant lessons which, if effectively leveraged upon, can potentially improve the health status of the Commonwealth. I wish to once again thank the organizers of this event for inviting me to speak. I appreciate Dr. Satya and Dale for the tremendous work they have been doing, along with other members of the Commonwealth Tribute to Life. I want to assure you that I will continue to solidarize with you, support, and of course, help to advance the objectives of the Commonwealth Tribute to Life. I wish you a very successful annual celebration. I thank you for listening, and I thank you for your attention. God bless the Commonwealth Tribute to Life. Happy Commonwealth Day. Thank you.
Well, that was wonderful, Osahon. Some of these challenges were known to us, but you brought the substance to other challenges, and you have been able to firm up those with the statistics and your knowledge of Commonwealth. We are fully aware that doctors are only a significant part of restoring health, but the health depends on many things outside the doctor's capabilities, such as sanitation, environment, government's actions, and all these factors are really crucial to be able to improve health in any country, and Commonwealth is no exception. You talked about the inequalities, and I'm very grateful that you highlighted those inequalities. If you think about inequalities in a country, that is significant, but Commonwealth inequalities are even more important because there are so many challenges, and quite frankly, unless we highlight them and work on those, nothing is going to happen. But the business as usual must stop, and it will stop only if we raise our voice and we are heard in the corners that we need to be heard about. But we need to be constructive in saying that this ought to be done rather than being critical only, because that criticism is really not going to get us anywhere. So very grateful to you for giving us thoughtful keynote speech. It will go a long way, and we will cherish your support as we have cherished in the past. We would like your support for Commonwealth Tribute to Life project, because there is another 4 years to go, and in those 4 years we want to achieve a lot. But with your help and support, with your blessings, we might get there. We might get there soon. Thank you so very much.
Thank you very much. Thank you.
Over to
me. Thank you, Sachin, and thank you, Osahon, for those words, and really sort of putting the whole challenges of what we're about to talk about of organ and tissue donation and transplantation within a big, broader Commonwealth health inequality conversation. What we're going to be getting now is what we're calling the Commonwealth Conversation. I was quite inspired by what occurred on March the 1st at the British Transplantation Society NHSBT special Commonwealth session, where we had a conversation going across some panelists all across the world. And so with my guests and my host, Lisa Burnap, who's joining. Lisa, would you like to introduce yourself to the audience?
Thank you, Dale, and it's a great pleasure to join you today. I'm Lisa Burnap. I'm a consultant nurse by background in the UK, but I am the Associate Medical Director for Living Donation and Transplantation within NHS Blood and Transplants. So I work in the same team as Dale, but on the living side rather than the deceased side. So thank you very much, and thank you for inviting me to join you, Dale.
Thank you, Lisa. Now I welcome Lucinda Barry from Australia. Lucinda.
Hello, everyone. Happy Commonwealth Day. I'm the Chief Executive Officer of the Organ and Tissue Authority here in Australia, which basically leads Australia's organ donation and tissue donation programs in Australia. So thank you very much for having me here tonight as well, Dale.
Thanks, Lucinda. And you're like the latest in the evening who's joined tonight, but actually, Peggy, wow, you've got up so early for us. We're so grateful. Peggy John from Canada.
Morning, everyone. It's early in the morning here on the west coast of Canada, and I'm very delighted to join. I work with Canadian Blood Services. I'm here representing my colleague, Catherine Butler, who is away on holiday. It's a family holiday time, spring break here in Canada. So I'm thrilled to be here, and hello, everyone.
Thank you, Peggy. I don't think you're doing it as a service. I think it's 3:30 in the morning on the west coast of Canada. So that has to be real sort of dedication. Thank you. Not quite as early, but still pretty early. Hasina Muhammad joining us from Trinidad. Hasina.
Hi. It's now 7 by us.
7:30 there. That's fine. Put your camera on, Hasina, so we can see you. That'd be lovely. There you are.
It's there. Okay, great.
You're there. So, that's good.
Yeah. So thank you so much for having Tobago. I am one of the anesthetic doctors that I do the deceased donation of transplant in Trinidad and Tobago. Thank you so much for having me.
Thanks, Hasina. Now to India, someone who's been very much part of this, the group who's really sort of driven this project forward, Sunil Shroff.
Hello, good afternoon to everybody. Good to see you all. I'm some of you, of course, know me. I am immediate past president of the Indian Society of Organ Transplantation. And I am basically a urologist and a transplant surgeon. Thank you again, Dale. And I think as we go forward, we'll have more conversation. And I like the way Lucinda said, Happy Commonwealth Day. So happy Commonwealth Day to all of you.
I think we're all learning about the Commonwealth Day and what the Commonwealth can bring. So it's fantastic. And our final person in the Commonwealth conversation to join us for this session is Voyi Soya-Parkby from South Africa. Voyi, you did a great job at Congress online. So thank you for joining us.
Hi, everyone. My name is Voyi Soya-Parkby. I'm a transplant coordinator from Groote Hospital, which is based in South Africa in Cape Town. I work specifically with deceased donors, sometimes with life-related as well, which is, I think last week was the time we got the opportunity to join the panel for the Commonwealth tribute thing, which was great, but I'm glad and happy for the invite. Thanks.
Thank you. Well, what we're going to do in this next 35, 40 minutes is really just have a conversation, and we've got no slides to share with you. We just want to, learn from each other as we talk. And I might go to Lisa Banat, my co-host today. Lisa, like we just heard from Osahon, all those great challenges in health inequalities across the Commonwealth. And here we are, and some people might regard what we're doing with organ and tissue donation and transplantation, when people are after sanitation and we're talking about transplantation, where do you see things from your perspective?
Yes, it's a microcosm of what's going on, really, isn't it? But I think it's, we saw at the Congress last week, Dale, the impact that every single donation and transplant makes on those individuals and the families, and I think if ever I think there's Richard Baker, who's the incoming vice president of the British Transplantation Society, said if ever we wanted to be affirmed about what we do, it's when you listen to those individual patients. And of course, we have enormous infrastructure issues in every country, and some far more difficult than others. But I think that we still have an enormous job to do around this group of patients who receive who benefit from organ donation and receive transplantation. And part of the work we do will also drive improvements in those other things. I don't think what we should do is to say we can't do anything because we've just got problems that are too big to solve. Because in the words of Sally Johnson, who used to be who was the director of OTDT in the past, she said, when you have an elephant, you eat it a bite at a time. And I think that's what we need to do. And we just really have to put our weight behind our collective efforts to do what we can. And we shouldn't be put off because the problem seems too large.
No, thank you. I think that's good. We're eating the elephant one bite at a time. Sunil, do you think, India is obviously a massive country, 1 billion people, and you've done a huge amount to promote organ and tissue donation and transplantation in India through the Mohan Foundation. Is sort of the messages that Osahon shared and that Lisa just reflected on, does that resonate with you?
Absolutely. When I look at the challenges and look at what was there 25 years back and look at today, we're definitely better off and we have progressed. So when you look at the timeline and look at how we have done things, I think we are moving forward. No questions about that. Of course, we need to do a lot more. And, the inequity is there. Access problem is there, especially in a country like ours. But, the good thing is, as the country is also progressing economically, there's more attention towards healthcare. And I think COVID definitely brought healthcare to the center point. And the governments are looking at healthcare without, previously what was happening was that the attention towards healthcare was a lot less, and the GDP expenditure on healthcare was a lot less. The government of India has promised to improve the GDP on healthcare. And as we are progressing, there is some certain schemes which have come up, especially in the field of transplantation, to be able to provide transplantation also to patients who are below the poverty line or who don't have access to transplantation. So a minimum amount has been guaranteed so that they can also have access. And that is a great improvement. India, as you said, is a huge country. We have 738 districts in this country. And the government has agreed to provide dialysis units in all the districts of the country. Districts are a smaller part of the states. So that will give access to a lot of patients who have end-stage organ failure. Obviously, yes, this region suffers from a huge organ failure rate compared to the Western world, and the transplant rate is a lot less. Of the 8 countries in the Asian region of Commonwealth, 6 do organ donation and transplantation, and 4 do disease donation and transplantation. Some of the countries which we don't do will require help, and that's where I think Commonwealth Tribute to Life project is going to be of great help to move them forward. I think give it those 4-5 years which we have, and I'm sure towards end of our perhaps tenure or first tenure perhaps, I think we'll see some progress in this region. Thank you, Dave.
No, thank you, Sunil. I guess that's sort of bringing it together. Like the biggest health challenge we've had in the last 3 years, of course, has been COVID. with massive amounts, and it's affected not only the health of the country, and it's had some social repercussions and worldwide supply chain discussions that's led to its changing the geopolitical discussion. But from a more sort of just our own little area that we are involved in the UK, our donation transplantation, our donation rates, deceased donation rates fell 25% during that bad COVID year. And we're sort of slowly recovering, and we still haven't got back to our baseline. I think we're around 11% off our baseline. We've also seen that our consent rate has actually dropped back to an 8-year low, which is quite distressing for us. But we wonder whether it reflects a frustration in society for being told what to do by health services. It's a very multifactorial. I was going to go to Lucinda in Australia, because I know you've just released your activity report for last year's, and any reflections on COVID and its impact, and also the wider health discussion we're having.
Thanks, Dale. Yes, so we released our 2022 results about 2 weeks ago, and like the rest of the world are still sort of seeing those impacts from COVID. Here in Australia, in early 2022, though, we saw our greatest number of infections and hospitalisations. We're a little bit above, running probably about 6 months behind the Northern Hemisphere. And so talking about baselines for us, we're at about 15% down on 2019, which is what we've sort of used as our baseline with that. We did see a slight uptake in the last couple of months of last year, which sort of brought us back to about an 8% increase last year on where we're at. But just like the United Kingdom, our consent rate is at an all-time low. It was 54%. So trying to understand what that is from a community perspective, as well as what's happening actually within the hospitals with our nurses and the conversation. But of course, just with visitor restrictions, our conversations with families in the hospital have been done either virtually, on the phone, with one family member only. And as we all know, families are absolutely critical. They need to understand that it is end of life before you can have that discussion. So there are still ongoing challenges with that. We hope that now families are permitted back in to the ICUs. There doesn't appear to be any restrictions at the moment. They've all been lifted. But even having protective gear on, masks, it's such a, it should be such a warm and caring conversation. And when you put those barriers up, there's always issues with that. So look, we've put out a 5-year strategy to try and work back to where we were, but we've still got a way to go.
Yeah, no, that's really interesting. And your words right at the end there about working back. I mean, we've been talking a lot in the UK, and Lisa, you agree, about back to basics. We need to go back to basics about, sharing the message, getting into the hospitals, getting it business as usual again. At least, do you want to make any comment? And then I might go then to Peggy.
Yes, I was just, Lucinda, from my part of the world, living donation, we've found, we had a complete cessation of the program for 2 months right at the beginning of the pandemic, and I think we've made an extraordinary recovery, but we're still about 10 to 20% off where we would normally be in any given year. Any comment from Australia on that? What we are seeing is interesting, and Del and I have reflected on this in our own internal conversations, our non-directed altruistic donors, so our anonymous donors, are still continuing to come forward as living donors, although obviously our living donor rate is still recovering. Any reflections from Australia on that at all?
We definitely as well were impacted with living donation, where we had about a 10% uplift last year, but we're still down at sort of that 20% down like you were as well. We've also got a paired kidney exchange program, which we launched with New Zealand. We've now combined to do that. And it was, it only had sort of one run before flights were no longer going, as we call it, across the ditch. So that program has only really just started to pick up again, but importantly, both countries continue to run theirs individually. But talking about that, Lisa, we're just about to sit down and talk about a living donation strategy. And in our region, and with the Commonwealth Tribute to Life linking us to a greater level, in particular with New Zealand. New Zealand has really gone forward with their living donation program. So where their doctor who's been running that's coming out to talk at the Australian Conference on Living Donation to see what we can do to try and lift that back to where it was as well.
Great.
That's very interesting how it's affecting everything, isn't it? Let's go to Canada. Peggy, with sort of some of the challenges with COVID and also with living donation as well. Any reflections, and what's your story been like over there?
Thanks, Dale, and hello, everyone. I'm certainly resonating with what everyone is saying, both from focusing on the foundational elements, but Canada's experience has been similar. So we also stopped our living donation programs for a period of time right during COVID. Our program activity has returned to close to pre-pandemic level, certainly on the deceased donation side, but is slower to come around on the living donation side. We've had some positives out of COVID. So certainly on the living donation side, our programs were focused, I would say they were program centric. So living donors had to travel to the program in which they were donating. And we've been working to change that. And COVID was the catalyst that has now seen a significant change there. So now mostly donors do not have to travel, which is a positive from that perspective. The other thing that we have realized certainly is that, again, we are having people, a significant drop in the number of people who are registering their consent to donate. We've now also had, for the first time, people saying, take me off the list because they disagree with the vaccine policies, etc. So we are, like Dale says, we are returning to those foundational elements about education, youth-focused education, and really sharing knowledge and information with our colleagues across the country. So that's been, and across the world, that's been very helpful throughout the entire time of COVID. So connecting and hearing and learning from one another.
No, that's really interesting. And I think that message of returning to foundations, back to basics is sort of resonating with me quite strongly. But I guess with like some of the bigger countries with donation and transplantation, I'm interested to see what Hasina, you think in the Caribbean. I know in Trinidad they do deceased donation and living donation, but at a much smaller scale across the Caribbean. What was COVID like for yourselves, and how have you been recovering from it?
Well, for us, I guess we echo the same sentiment. However, so it impacted us a lot because we technically have 5 countries out of all the Caribbean islands doing having a transplant program, and a lot, maybe 3 out of 5 of these countries rely on international collaborations. So, and this is for our living programs. So what happened with us is when we had that stoppage of flights in and out of the region, we couldn't have our visiting surgical teams to come and assist. So for us, our transplant numbers were down, and that affected the living donation part significantly, because the majority of them would rely on assistance for their living programs. In terms of the deceased donation, well, Trinidad has a deceased donation program. Our numbers initially in 2020, we still were able to, so backstory, technically in Trinidad, we tend to get maybe 2 to 3 deceased donors per year. It's still a young project, and we're still trying to work out all the kinks in it. So in 2020, we didn't really have that much of a decrease. We actually still managed to get 2 deceased donors, and that was mid-year with COVID ongoing. However, of course, we took precautions in terms of testing the donors, testing the recipients, and but in 2021, everything basically came to a halt. Living and deceased donor programs came to a halt. We're starting to pick back up in 2022, so it's much better, and we're back to basically pre-COVID numbers, believe it or not. But like I said, our numbers are small, but we're back to where we were. So I think that's absolutely great. And we're off to a good start in 2023. For us, though, we also had, our mandatory vaccines, and that was an issue for a lot of people in terms of, they having to have a vaccine to be on the donor list, having to have a vaccine to be on the recipient list. And a lot of people didn't want it. And just recently, we had a child who was supposed to have a transplant from a parent, and the mother initially was absolutely against having her child vaccinated, but now she's looking to get the transplant, and the child has to be vaccinated. What you need to understand is that we also were limited by resources that were coming into the Caribbean. So we didn't have readily access to vaccines as well. We relied a lot on donations from other larger countries. Spain, UK, India gave us a huge donation as well in terms of vaccines. And because of that, now this little child has to get vaccinated prior to getting the transplant, and we have no pediatric vaccines in the country. So we still working out our kinks and still trying to, source resources and try to see what we can do. But basically, we're getting back to our pre-COVID numbers because flights have started back again, and a lot of the other Caribbean islands have restarted their transplant programs. And I think, we're on a good side in terms of where we're heading. So once we could continue those international collabs and get back on board with the vaccines, I see now internationally, sometimes vaccines are no longer mandatory. So I guess it's just a kind of review as things keep coming in, because even though COVID is 2-3 years old, it's still kind of evolving, and there's always something new with it. So we're just working with what we have at the moment. Yeah.
That's incredible. And I hadn't ever, and Lisa, I don't think I'd ever really thought about the concept of the link between the vaccines. And we know in the UK that we've got some good data now that transplant recipients need a number of vaccines for it to really really have an effect on them. But the whole development there, any thoughts from you?
Well, I mean, we had some challenging conversations. In fact, one group got together and wrote a paper in the London area around, the ethics of excluding people from the transplant list because they refused a vaccine. So we had those challenging conversations, and they are very difficult. I think what I'm interested in hearing is actually some of this impact on consent rates, and Dale alluded to it earlier, is this imposition of, people feeling that they have things imposed on them from on high, and how that's affected them. And also for us in the UK, I think the struggle within the NHS for people who need treatment and care in a timely fashion has had a huge impact on their goodwill. We went through, Dale has a lovely way of describing this, but we went through a way where we were clapped, and that was slightly uncomfortable. But then we now talk about the slap, and it's people are very struggling to access healthcare, and therefore their willingness to then consider donation and transplantation for others, I think is definitely, we feel there's an impact on that. The other theme that's coming through from all our conversations, I think, is that one of the positives from COVID is that ability to collaborate in a different way and work in a different way. And we certainly saw that within the UK. And actually, it's absolutely strategic for this project, isn't it? That we can use those lessons learned in our own countries to share with one another and how we work better together. So I'm very struck by that.
No, thanks, Lisa. Yeah, my saying is, after the clapping comes the slapping.
Yes.
But that sort of feels a bit like and that. Voy, how in South Africa, like, yeah, I mean, from thinking about that and the COVID and the challenges, especially what you heard from Hasina and the others, what was it like for you in South Africa? I know you're an intensive care nurse as well, so it probably would have been quite full on for you as well as a donor coordinator. And where are things now, and anything positives on the horizon?
Yeah, for us, yeah, it was quite difficult because we separated in two. There's a state and the private sector, right? So I'm in the state sector. So our institution, which is Groote Schuur, they closed for a couple of months when we reached the peak of COVID, but then we reopened. But in the previous years, we had beautiful numbers, both living and deceased donations. But in 2020, we had a drastic drop, like a serious bad drop. And we haven't reached the numbers that were before COVID, but we're getting there. Over the years, becoming better and better. However, you guys mentioned also that with COVID, we learned quite a few things. Some people have learned that you don't have so long to keep things up. So you have to open up the discussion about donations. So more people are talking about things and their wishes, because anything can change anytime. I mean, COVID showed us flames, showed everyone flames, that the longer you wait, you don't know what tomorrow holds. So some people now, they're like, this is what I want to be done with me. And so when we approach families for deceased donation, they're always like, okay, fine, because we lost so-and-so through COVID and we couldn't donate, although we wanted to, because during COVID, we were not taking any organs. Even now, we do only take the kidneys for coincidental COVID. But if you have to concentrate on the characteristic organs, we can't. So some people, they're still holding on to that. Let's give. They're more about giving now, although it's a long way to go, but it's become better when it comes to deceased donation. When it comes to related, it's quite different because we couldn't do most workups because most departments were closed. Even we as the transplant coordinators, we had to go back and assist in the critical care units because the theaters closed. So it's slowly coming back. We even have backlogs of people that we've started working up a couple of years before COVID. Now they're open, and then some have changed their minds. At the moment, they're like, okay, fine, can we just hold on a bit? But we're getting there. We're getting to where we were before COVID. And some places we're becoming better than what we were before COVID. But we learned quite a lot, to be honest.
That's fascinating. So you're telling us that there is a positive feeling about giving, and I really like that. The thought that actually there are some positives coming out of COVID. Do you have in South Africa anything like an organ donor register or cards, or what do you have in South Africa?
We have the Organ Donor Foundation, right, where people can register to donate, and they do get cards posted to their homes. However, they are the ones that can see the data. We as the transplant coordinators have no access to that. So we don't know who has donated, of which that's why when we go out for public education, we always emphasize that talk about it. Don't just go register while you're laying in bed on your phone and then go to sleep. And then you wake up the following day and you haven't discussed with anyone, because no one will ever know what you decided. So we always say, rather than to go and actually register, to rather talk about it. Maybe you might just find yourself that there's 10 more people in the family that want to do this, instead of just keeping quiet about it. But we do have a registry where people can register for organ and tissue donation at the same time. And we also have a tissue bank, whereas with COVID, with our colleagues, they said that, they can't really go to the mortuaries anymore, because that's where they get their consents more than in the hospitals, right? So they had to actually just sit back and relax, because most deaths that are occurring, it's COVID, everything. And because the country was on lockdown, you see, so there weren't many trauma cases happening out there for them to go through the morgues to get the consent. So their rates also dropped. But things are becoming better, and we are hoping for the best.
That's Lisa and I know that actually our tissue donation in the UK, especially corneas, has really dropped, and we're almost having to rebuild the pathways that we used to historically have for the referral pathways. Staff have moved on. We've realised a lot of it was built on the goodwill of a number of key individuals, and as they've moved on, we've needed to rebuild the paths. I can see Satya has put his hand up. But do you want to join the conversation, Satya? What would you like to sort of talk about?
Yes, in fact, the comment that was made from South Africa that they only take kidneys from COVID-affected people, I remember taking part in a webinar in India where the experts had all talked about what parts should be taken and what should not be taken. And the consensus at that time seemed to be that, well, COVID is COVID, but on the other hand, why worry too much? Now, Sunil might be able to enlighten us a bit more about that matter. And I think sharing that conversation might help all of us, if not South Africa alone.
So what are you doing in India with COVID patients and donation and transportation?
Yeah, it really depends, the status of COVID, and the current guidelines are quite relaxed. If the patient has had mild COVID, and if the CT shows the lungs are clear, then they take almost every organ. The guidelines have changed over the years. I mean, over the months, in fact, not years. So yes, we are now getting a little bit more, perhaps, aggressive in taking donations from COVID patients. Of course, we've had patients with severe COVID we have not taken. So it varies from case to case. But, having heard all of you, very interesting conversation, in India, actually 2022 was a good year for us, both for living and disease donation. In fact, the best year perhaps, because we had a great drop in 2020 and 2021. We saw almost more than 50% drop in our donation program. But 2022, we have really come, I think the numbers are just out. We have done 15% more living donations than we've done ever. And same goes with disease donation. I suspect one of the reasons may be that there was an improvement in infrastructure of the hospitals during COVID. We had, so many, ventilators were supplied to the hospitals in great numbers. So I think that may have contributed to some extent for this increase in the number of donations which you had. And 2023 has been a great start. I think we'll do better than 2022. So I think as far as, we've not had the slap kind of situation in India. And we also have less number of patients with the challenge of refusing vaccination. Like you have very active groups. We don't have that kind of activism at the moment in India. We don't see that. It is there in very small pockets, but not to that extent as you are facing in the West.
No, that's great. Yeah, it just shows you that actually, the different infrastructures, different cultures will have a different effect, and we're seeing that. I want to go to Peggy, and especially I want to turn the conversation to the positives that have come from COVID. V, you've got your hand up, or did you want to make a comment?
Yeah, no, just thinking about vaccines. The thing is, with us, surprisingly, some families that for life related, they were like, no, some don't want to vaccinate. It's a requirement. We have to get the vaccine in order for you to donate. But for the recipients, they were all open. In our clinic, in our dialysis clinic, we brought the whole team. They had to vaccinate everyone. And everyone was open to it. But when it came to donors, some were hesitant. Like any other vaccine, like any other person, they were hesitant. But surprisingly, most people are like, I'm only vaccinating because I want to donate. So they were very much open to it. And when it comes to that, we didn't have much problems when it comes to the vaccines, both with the donors and the recipients. But it was quite good, actually.
That's very interesting, actually, because we had the opposite. We made it optional. We strongly encouraged everybody who was going to donate to have a vaccine, but we didn't enforce it. We had no ability to do that. But that's interesting that actually people were more driven by the wish to donate, and therefore they were able to overcome their vaccine hesitation. Interesting.
Peggy, we'll go to you and thinking about sort of some of the positives that have come out of COVID, if you want to sort of comment.
Certainly happy to. From my perspective, again, it has been really about focusing on the foundational elements that support a high-performing system. And so Canada's a federated country, so the donation and transplant services are delivered at the provincial level. So there's a wide variation across the country in terms of patient care and access to services. And so certainly right at the start of COVID, when COVID hit, we started as a country, our program brought the country together on weekly and bi-weekly and then at varying levels of calls to talk about how we could deal with the COVID situation together. And soon after that launched the international calls that took place with the same kind of frequency. And we were able to, like Lucinda, find out, well, okay, we're a month behind and they were further behind. So it was certainly having this network of colleagues from around the world was tremendously helpful. And it's really, I think, sown the seeds for us to continue to recognize that we can share more than just information. We, if there's a good idea from somewhere that can work in your country, then why reinvent the wheel? V talks about conversations, and that's what we're also focused on as well, is how can we encourage more Canadians to talk about organ donation, regardless of whether you register. Certainly register and say you're going to consent, but tell someone that you've done that, so that will have a positive impact on donation at the time. So so from our perspective, some of the wins really have been about connecting and about recognizing that we do know what we need to do, and we just need to stay the course and to try to continue to share and improve the systems that we have.
Yeah, no, thanks, Peggy. I really want to thank Canada for its leadership of those meetings. I still remember hearing, like in 2020, about April, May, or may have been, when we were hearing really like Italy and Spain were sharing their experience, and we were like about 2-3 weeks behind, and it came. And then we had Australia was on the call, and Suna was on the call, and it was just that it did feel like, despite everything and despite the barriers some countries were putting up on other aspects of health, we were actually in our community of donation and transplantation were sharing between ourselves, and we're all in it together. So thank you for that time. Let's not have it again though, but I think the lesson has been really powerful. Lucinda, when you think about Australia and sort of the lessons from Commonwealth, lessons from COVID, what do you think you're taking forward as a country or as a region?
Look, on the back of what Peggy said as well, there is no doubt that collaboration, and both at a national level for us and international, a virtual platform. And look at us all here now talking to each other from around the world, whereas before we do it, but it wasn't just done so regularly. None of us now get told you're on mute anymore, because we're all very good at it. But we as well set up a national task force with the Transplant Society together, and brought the key infectious disease people together on that as well. And that's still running sort of every 2 months, but just that bringing donation and transplantation together has been an amazing thing over the last sort of 3 years. And there's one other key area for us, because we couldn't do in our community program, most of our community program was on the ground events, which is probably, like most people, to raise awareness. And so we really had to, as the word they talked about, pivot very quickly to work out what we would do for our Donate Life week. And so the learnings out of that is just how much more reach we've had by doing it on a virtual social platform. It doesn't take away from those key events, particularly where you're talking to people from multicultural nations, but at an upper level where you can really target. Youth has been our target, and we were able to go onto platforms that we'd never really considered to go on before, where youth were all based on their behaviour. And we had a month where over basically a 2-month period, we got 100,000 registrations, because Australians were called, they had to download their vaccination certificate on our health site app, and sitting underneath that was the organ donation, tick a box. Did you want to register? And we had an 82% increase in registration in 2021 because of that. It was a fluke. We didn't position it that way, but what it's shown us as well behaviourally, because we know the majority of people support donation in all of our surveys, but it has to be quick and it has to be easy for them to register if you want them to register. And like South Africa, we've flipped our message as well to say, talk about donation first with your family, because we just know that a lot of people don't get around to registering. But if you can find a catch, not that we want to go back where we were and have people have to download vaccination certificates, but it was quite amazing to have that many registrations from a ticking a box.
Yeah, no, that is fascinating how you can the behavior change, and people do want quick. They want to support, but they want it to be quick and easy, like a lot of things in life. We still get a lot from our driving license registration in the UK. That's how we get a lot of the comments. Peggy, back to you.
I'm just picking up on what Lucinda said. During the first year of COVID, we had a 39% drop in the number of people who registered their decision. And that was based on the fact that up to that point, most people registered because someone asked them to. When they were at a government office renewing their driver's license, or when they were seeing someone at a community event, and we couldn't do that. And so similarly, we as a national collective have shifted to what are those online platforms where we can connect. We are starting to connect in person, but again, because we have a federated system this year, next month, April, is Awareness Month in Canada, and we are launching a new national campaign that is focused on leave well so others can live well. So it'll be the first time we have a national platform that all provinces can collaborate on. So we're looking forward to that.
Well, huge congratulations, because I know getting all the provinces or states and different places to all agree of a national campaign can be a huge challenge. So, yeah, so leave well so that others can, just say it again so we can hear it. What was it?
Well, so others can live well.
Oh, brilliant. Really,
nice
really brilliant.
message.
A nice message. We're nearly out of time. This conversation's been rapidly going through, but I just want to finish. If anyone would like to make any comment about the benefits of this Commonwealth Tribute to Life project. We've heard about our collaboration and sharing, and maybe any ideas you've got for the next year or two of what you think the project could do. I might go to Sunil first and to see what thoughts he has.
Thanks, Dale, again. We had an excellent webinar with Lisa on living non-directed donations, especially for kidneys. And I think in the UK, you have a great experience with that. There's an opportunity to increase the donation rate in India with that. We need a proper template for that so that, we don't slip into any organ commerce. And we are collaborating with Lisa. She did a webinar for us. Then we did another webinar, and we will be taking that forward. So that's a great learning from the Commonwealth Tribute to Life project. The other thing which I would like to inform the group is that the International Society of Organ Donation and Procurement has recognized the webinars which we did last year, and they're going to have it on their website so that it has more visibility. The one thing which I would like to suggest to you, Dale, is that if we can come up with a template so that when we have meetings, national meetings here, we could affiliate with the Commonwealth Tribute to Life. And if there's a simple form available on the website for that kind of opportunity, that would be great help. Then the Keynote perhaps can distribute that information to rest of the Commonwealth countries, because we have at least 3 or 4 meetings coming up in the next 6 months or so, and we would like Commonwealth Tribute to Life to be part of that meeting. And some of the meeting, just like you did with BTS, some of the stuff can be, for the meeting can be transmitted on for others to watch, because some of the topics could be of common interest to other countries. So that's one suggestion which I have, that we could do that. And then I wanted you to also perhaps speak about the art competition which Ben is going to lead from Singapore. And Hemal, our project leader, also has something to tell about that art competition as well. Thank you.
No, thanks. And I know you've got to go at 12 o'clock UK time, so that's absolutely fine. Lucinda, you just had your hand up, or any thoughts on what you think for the project? And we don't forget, I'm going to put, we've got Victoria is the Commonwealth Games in 3.5 more years' time. So we're all looking forward to visiting you there, Lucinda. But what are you going to offer in the next year or two? What are you thinking?
I was just thinking on the back of Sunil speaking there, particularly around living donation, whether we actually have a session, and for us here in my region, in particular, that's probably one of the areas where some of our Pacific Islands may be able to start a program. Not so, they haven't got deceased set up, but we do know that a couple of the countries are quite keen maybe to look to see whether they could start with living. I think it'd be great to have a session globally for our Commonwealth countries on living donation and hear where countries are at and what they might need help with if that's where they're going to go.
No, that's a great idea. We can do that. We're almost out of time. I'll come to you last, Lisa, but Vuyi, do you want to say any final comments?
Oh, yes, just something exciting. Maybe, obviously, some countries have had this for quite a long time, but we did the first glycosol immune adsorption this year, which is going to help expand our donor pool for ABO incompatible transplants. And we also just received the first kidney transplant machine, the ex vivo. We haven't used it yet because we're still waiting for the consumables, but we're very excited for that because we really need the expansion. We're desperate for it, but it's one of the new things.
Yeah, exactly. And it's a technology revolution coming, but I think it's, we've got to make sure we keep things affordable for all Commonwealth citizens as we move forward with that. Any final thought, Peggy, and then Hasina, and then back to Lisa to close.
It's such a wonderful opportunity. We don't have to reinvent things, we can share. And I know Canada, we have some wonderful resources we're happy to share. This is a great platform to do that on, so thank you.
Yeah, thank you. We need to, Keil and I are going to look into the website to sort of create more links outwards as well. Hasina, any final thoughts from you?
Well, coming back to the lessons learned, I think the international collaboration and the use of the virtual tool has been really excellent, because while we were on our downside, it allowed the Caribbean region to actually have access to a lot of those educational webinars and programs outside there, and that we were able to build. We even had some countries getting their legislation up and running, which is actually great. So now it's no longer just 2 Caribbean islands that have legislation, it's 3. And more in the works. So I think a huge part of it was the project, the Commonwealth project, because they had these webinars and they showed us how to set up labs, because we don't have any labs in the Caribbean except for in Trinidad. So it was really very, very, very educational and very informative that we had these webinars. In terms of what we have coming up, we had a lot of things. We have a lot of things in stream. And it's really, it's very exciting. Our Caribbean College of Surgeons have actually launched their transplant chapter. And, it's not open to just surgeons, which is good because, surgeons. But, so, I mean, it's all inclusive. And that's a great tool, because we come and we discuss cases. We actually had our first meeting earlier on in March where cases were discussed, and it was quite very impressive, rare things that were happening in Antigua. We were able to discuss it, and everybody trying to come up with some sort of ideas to how to proceed. In addition to that, we still do have the Caribbean Donation Transplant Society on board. Hopefully by June, that should be up and running, and that should be able to connect everyone as well throughout the Caribbean island. So we have exciting things in stream for the Caribbean island. Yeah.
Wonderful, wonderful, wonderful. Just Lisa, final words from you, and we'll close our Commonwealth conversation for this year. I'm sure there'll be many more conversations coming.
Well, thanks, Dale, and thanks everyone. And I think for me, actually, because I'm very much a people person, actually building those relationships and meeting people, and some of you I've seen more than once now on these calls, and that's really lovely to make those personal connections. And I think that makes us all work well together. So for me, that's really critical. In my part of the world, living donation, one of my ambitions for many years has been to have a network that supports. A lot of our patients have family members who live in your countries and actually want to come here to donate, and then they go back home again. And one of my visions is for us to work together internationally to support living donors, to enable them to be followed up, to be assessed in part before they come to the UK, so that they understand what they're doing and what they want to do. And I think that provides confidence and assurance in the international program. So that's something that I'd love to work on with all of you, just in my part of the world. But thank you all, because every time I come onto these things, I really learn from all of you too. And I'm very happy to not reinvent wheels. Duplication is absolutely a waste of effort. So anything we can do together and better, that's for me.
Thank you, Lisa, and thank you, Lucinda, Peggy, Hasina, Sunil, and Voyi for that conversation. We're now going to move to talk about a proposal we just want to share with you. It's an idea, and we're hoping we might be able to get it up and running in 2023, and that's a Commonwealth art competition. So we're just going to welcome Benjamin from Singapore, and also Hamel joining us from the Mohan Foundation in India. But we thought we'd start with Ben. Are you happy to share some of what Singapore has been doing with art competitions? Because we just want to excite you about the possibility of running something, and maybe, just maybe, this time next year, Commonwealth Day next year, we'll be able to announce some winners. If you're not speaking, just turn your cameras off, and we'll just have myself and Ben and Hamel on. Thanks very much, Ben.
All right, thanks Dale for the introduction and just being excited and in hearing about the forum, the discussion. I mean, we are all talking quite similarly about engaging the youth, engaging to start that conversation. Yep. So I think in Singapore we have been quite similar to that. We want to engage the youth as well, because we know it's very important to talk about it. All right. So and we know, all of us as organ transplant professionals, we know that conversation is an important one. Unfortunately, youths are not engaged in that conversation, not predominantly engaged. It is not their primary focus. And we've tried to incorporate and work with the schools. For example, we know about Australia, the Donate Life. We've been having curriculums for schools. And we look at Singapore, we look at the environment that we have here in Singapore, and we see that it's actually very competitive. We have the Singapore Youth Festival. We have the Yellow Region Project, which is about a prison, unlocking a second prison. We have total defense, firefighting, and all these gets incorporated into the school curriculum. And in the face of all these issues that are equally important, how does organ donation stand out? And we've also looked at competitions. We look at how competitions attract people, and you see we have a postcard design competition with our National Kidney Foundation. Our Ministry of Education has been holding Our School, Our Stories photo contest, and in fact in Singapore, schools participate in the Queen's Commonwealth Essay competition every year. So again, within the competition arena, it is already quite a big fight. So how do we make organ donation itself stand out is really quite the challenge for us. And so we've actually developed over the years Live On Festival. So as part of the festival, we have a design and essay component. So design competition, we get students, general public to design the artwork about organ donation for tote bags. So the top winners will actually get their artworks printed onto tote bags. And likewise, essay, we give them the topics, they write about it, and then later on we publish them. All right. So this is the main crux of the festival, the competition. But essentially, anybody can hold a competition. But what is really important and the foundation of it is the workshop. We hold an organ donation workshop to schools, And this is aligned to the school curriculum. We have citizenship and character education segments, art, English, and science. So it aligns to all this. And for teachers, it becomes an easy tool to adopt because I teach all this in class, but organ donation now becomes a tool, a lens for the students to interpret their world, to explore and to flex their muscles apart from the theoretical knowledge that they learn in the classroom. They can now apply in a complex and real world situation. And so we've been conducting organ donation workshops in big cohorts as assembly slots where we have thousands of students, or even in small group settings like this in classrooms. But importantly, at the end of it, it must be proper prizes must be awarded. And so here you see two of the past winning artworks where students actually conceptualize, how donors actually heal and repair a kidney, for example. And on the right, you see how organ donation is portrayed as a passport to a new beginning, where you see the bottom is dull and dark, and the top is very lively. And so these excellent artworks are then awarded at the award ceremony. And here you see a guest of honor, our Minister of State for Education, presenting the prizes. But right in the middle picture, we see a student going and attending the ceremony with their parents. So earlier on, I think we mentioned a little bit about how to have that conversation. Here we have students, young students, bringing their parents along for an award ceremony and having that conversation with their parents on the spot, right? So we are actually making them talk, discuss about it, not just for the workshop, which is a 1 hour session, but in so many points of interaction, they have multiple opportunities to showcase or to talk about organ donation. And this is where we want, we have been pushing so that people can actually have that conversation, or plentiful opportunities to think about it. And apart from the award ceremony, we do, we maximize the artworks because they are so wonderfully created. We actually bring them to hospitals. We have roving exhibitions across most of our public hospitals. We bring them to libraries where the community gets to see the artwork. They get to see how good it is. And hopefully they wonder, what is this artwork about? And hopefully they will spontaneously do their own research about organ donation. So over the years, we've started in 2018, we've worked with 4 schools. We have some entries received, and about 1,600 students attended the talks. That was our pilot testing. Over the years, we have gradual increase to 12 schools, but then COVID struck, right? So we always talk about COVID and the barriers it has. So we were wondering, 4 schools 2018, 12 schools 2019, what will 2020 bring? And so we know that there's always a risk of issues going up and down and all that. Adoption, but we have to rapidly adapt to the online curriculum. Schools were closed physically, but they shifted engagement online over to Zoom platform. And likewise, we adopted online curriculum quickly. And 2020, we had a huge jump to 52 schools, and where we conducted what previously lessons were physical, now we had it online, and we had students joining in from the classrooms, and over 3,800 students attended the talks in 2020. We also shifted our award ceremony online, where we have the guests of honor do the presentation online. And interestingly, we observed that even though we've only conducted workshops in 48 schools, but due to word of mouth, 52 schools actually participated. So that 4 extra schools came by word of mouth from students, their siblings of participating schools, right? 2021, we saw a sustained increase all the way to 89 schools, which actually represents about 65% of all secondary schools in Singapore. And we had 7,600 students attending these talks. These are the students who have listened to our organization talk about organ donation for 1 full hour. And of these, we had about 230 teachers who attended. And it is very important because the teachers' attendance hears about organ donation, reinforces, dispel myths, reinforces positive messages, and they themselves hear that organ donation is aligned to their values. and as a result of it, they can increase in their reach. In this Live On Festival, year on year, it's a cycle, positive reinforcement cycles. This is good. I want my students to attend it next year. Let's go on, and it comes on and on again. Last year, we had, again, an increase in schools, 107, representing close to 80% of all our schools in Singapore. We've reached over 12,000 students, close to 400 teachers attending, and we hope this will again serve as a foundation for 2023. In terms of artworks and entries received, we have essay and design competition. Altogether, we received close to over 4,200 entries received. So these entries are actually done by students and general public who had spent time to research, pore over information, and craft their own design, craft their own essays. And so these, we can be assured that these 4,200 people have thought deeply about organ donation. And this is, we think, what really matters at the end of the day. These 4,000 people are the ones who will be our ambassadors moving forward, right? So we get the students to reflect as well, to give us feedback, and this is a secondary one student, a 13-year-old, 12 to 13-year-old, who can, say that, it's a meaningful session, and they learned to be willing to make sacrifices, even with the risk of hospitalization, for example, coming from a young student. And a Sec 4 student, 16-year-old, says that he wants to bring awareness to people around me who might see organ donation in a negative light. So these students, after hearing our talk, after participating in competition, wants to go and dispel myths, right? So this is actually the impact. I'm not just impacting one student, but this student goes on to impact others, right? So, and not just the students, the teachers, when they're observing the students, they saw that the students research and learn how to do the image manipulation independently, and it becomes a meaningful artwork with purpose, right? And lastly, this teacher reinforces the thought of, how organ donation itself can be a tool to apply what they've learned in biology classes. And then the students learn how, in practically, how the students, patients on dialysis suffer a lot more than we realize. So we are bringing the problem to the students by telling them, these are the dialysis patients. They have gone through and suffered so much, and this is one way where organ transplant can help them, right? So I will just end off with this, that, we realize and that it really takes a village to raise a child. All of us here who are attending, we need to jointly raise a child or raise children, and actually the commitment that comes from us should be nothing less. And if you're interested to look at the pictures, some of the artworks, you can actually, so these are done by some of our students over the past years, you can actually scan this QR code to view all the past winning artworks. Yep, I think that's all from me for now. I pass back to Dale.
Ben, that is just amazing. I'm just sort of overwhelmed by the professional engagement with the schools, because it's not just an art competition, it's just an excuse to do that. And there are roving art competition in hospitals where the art moves around to showcase. I could just see that working so well. That is fantastic. We're going to go and ask Hamel to come and share what she's doing, and with the Rohan Foundation and other work with the art competitions. And this is just seeding our imagination and ability to sort of drive things forward. So over to you if you just need to, I think, launch
Thank
your...
you. Thank you.
And
Can you hear
that
me?
looks perfect. Yep. I'll close off. You go.
Okay. Thank you, Dale, for this opportunity. And I have been, part of listening to some of the webinars that you have conducted, and it's really very engaging and very educational. Thank you for this Commonwealth project. A little bit about our work. We have been using metro stations to create artwork, and we use this artwork in other activities also. So one of the traditional art forms that South India usually has is called as Rangoli or Kolam. It's like a street art. And it is usually traditionally used is rice flour, but now colored flowers, colored powders are used to create designs which are usually used in traditional customs of festivals and celebrations. So the theme is Ariyad Korangal, and it is actually used to create awareness on organ donation and to celebrate the act of giving life. So all information about our art festival is done online as well as through emails through all the links that we have developed in Chennai. This is basically a Chennai-based program. So we've done 4 years of this art festival. It is always linked to some sort of festival which is linked with Tamil culture, whether it is the festival of harvest, festival, whether it is World Kidney Day, whether it is Tamil New Year or Diwali. These days we conduct these programs, and you can see the award-winning artwork done on the street floors. This is just on a street floor that we do. It is common for, it is open to everybody, and there's no restriction. We just have a student category and adult category right now. And lovely designs, lovely thought processes go into this. So this is our, as everybody was mentioning that during COVID, we also went online and we had an online competition. The best part was that a lot of people from all over India participated in this competition. We nearly had more than 250 participants in this online project. So these are some of the activities that we did. And so they had to come online after we shortlisted them, and they had to say what they were doing to a panel of judges. So for every artwork, because it was online, they had to give us 3 pictures or a short 30-second video of the way they developed the Rangoli. This is the prize-winning designs over this side. So this is how it looks, Usually metro stations have a lot of footfalls. A lot of people come through it, and they have big spaces as car parks, and we use those spaces. We've been very lucky that the metro station has agreed to sort of partner with Mohan Foundation to conduct these programs. And we need a good quality judges for this, somebody who's subject matter expert, somebody who is, artist, and somebody who can always sort of provide some more inputs to the art that the students have created. So we have these type of judges going on. The size and the time duration is also important. Size should be, 3 by 3 feet, and duration 1.5 hours to 2 hours is enough. But as a precaution, you always have to give an hour for the judges to judge the competitions, because a lot of thought process go into these designs, and the artist has to be able to deliver that whole thing very properly to the judges. So you have to give time. Sometimes the judges, in my experience, say that it's very short time for us to judge. So that is how we need to give more time. And interesting gifts and prizes have to be given. Gifts have to be given to everybody who does participate, because that generates a feel-good factor in our competition. Sometimes the guest of honor need not be a government official. Sometimes they get inspired by just people who have received an organ. So we invited Mrs. Lingaselvi, who had got double hand transplant. And she was so inspiring the way she spoke in Tamil to all the people who had come there and done the Rangoli, that they still remember after 3 years, they still remember, is she coming? This is what they asked, So getting a person to give away the gifts is also something that you should think, because they have spent 3-4 hours doing the artwork. They have spent time reading up, and also something more than just a prize, but something that they can take back with this. This time we had a double kidney transplant recipient coming, that he was also very, very effective in generating a lot of buzz about organ donation. And this is something that has been done on the entrance of a public hospital during organ donation. So thank you all for the listening, and any questions, anything we would like to take. I really like the idea of Singapore's art festival. It's amazing work done by them.
Oh, that is just stunning. I love the street art and how colorful it can be. But what's really struck me. I'll just ask Ben and Hemal a question. It's like taking it's not a passive thing of waiting people to bring their art to you. You've really gone out to the schools, to the hospitals, to the community. Ben, any thoughts about how about that?
Yeah, I think we recognize that the challenge is there to get people to spontaneously bring up the topic of organ donation. And we know it's important, but people just don't. So we really have to craft and we thought that art competition itself is something that unites people. People can see at one glance from far. You look at that, the Pongo draw, it's so attractive visually. It's a masterpiece, right? So when you look at it from far, you're visually attracted to it, and then you can just think about it. What's the intention behind it? What's this thing all about? And I think that's what we're trying to do here in Singapore as well. The people draw, the students draw, but we also have the people, the passers-by who get engaged as well.
Yeah.
That's very good. Hamel, do you want to?
Yeah, because when we did it in the car parks of metro stations, we had boards outside the metro station that for 2 days this art festival is going on. Whenever whoever is walking through and not going to come to the car park, please visit the car park. And we had people coming over, near 200 people came after the festival to just see what was there. So it does help out, but we need to publicize a lot, and we have to take it to them in their own language. Especially for India, we are very much vernacular and local cultural specific ways. You have to get them to come to the event.
No, that's just totally brilliant. I can sort of see what I'd love to do is I'm going to take out after this, I'm going to divide up the art competition out of this video, a live footage, and just have a little the two of you just sharing your ideas, so we can pass it around the Commonwealth, and I'm going to pass it around the UK because it's such an inspiring aspect. But I do hope that we can sort of everyone can be running a little art, their own art competitions in their nations, and then we can take some of the best pictures and make it a Commonwealth wide, and it'll be small to start with, just like all this project has been, but we can build and build, and then we really have that community. Thank you both for sharing that up. Wonderful.
Could I say something? Just
yes,
one thing, that Tamil 14th or 15th of April is Tamil New Year. So if there are Tamil diaspora in your countries, you could just attract them with some sort of Rangoli competition, because that's what they do, a lot of Rangoli outside their houses.
Oh no, yeah, a brilliant idea. Use those sort of established ceremonies and opportunities. No, wonderful. Speaking of opportunities, I'm now going to invite Professor James Neuberger, because art is one way of uniting us together, but the other way is actually through sport. And James is going to share some of the transplant sport and some of the ways we can use sport to also bring people together. So thank you very much, James, for joining today, and over to you.
Thanks. I'm going to try and share my screen successfully. And if it goes wrong, apologies. Can you see it all?
Yes, just push start, just launch your slideshow, and it looks perfect.
Hang on, I've lost it. Can you see it?
It's coming.
There. Yeah.
It's all gone black for me. I'm so sorry. Oh no, it's just in presenter view. So if you just want to just display settings and just change, James, up the top there, display settings.
So come up.
You're at the end of your show.
Yeah. Hope you're going to edit a lot of this my incompetence out of here.
Just start the slideshow again. We can take it from there. It happened for me as well when I was doing my talk.
Okay.
So
can you?
Yeah, just
slideshow now. Can you see that? Right. Thanks very much. I speak on behalf of Transplant Sport, and this is a UK-wide charity with basically two aims. One is to increase the well-being of the transplant recipients, but also to celebrate organ donation and transplantation, and not only provide a forum for support for the recipients, their families and their donor families, but also to promote organ donation. I think it's important to stress that we, like other organisations, work very closely with NHS Blood and Transplant and the Donor Family Network, as well as other transplant games, because it's important that messaging is complementary. The lay games this year we held in Leeds in 2022, and it was well seen. And I will show you some data to show the benefits of that transplant games can have in terms of organ donation. It's good. Large numbers of people take part, and you can see some data here. Over 2,000.
Sorry to interrupt, James. I think you just got to push the slideshow button again. Just the bottom. We've just still got your title screen. It hasn't advanced to the next one.
It's advancing for me. You see it now.
No, we're still on the on your title one. Maybe just stop for a second and relaunch it. It's a shame because we can see in the side there's some nice pictures, but all we've got at the moment is the slide sorted.
Is that better?
No.
No.
If you move your cursor down to just the if you go to slideshow button, then we've got the little blue circle going around, which looks like it's
Can you see it?
Hang fire. It seems
on
to be
my
stuck.
screen. Would it be easy if I sent you the slides?
Yeah. Why don't you send me the slides and I'll launch it? And in the meantime, while you do that, I'm going to invite my colleague Harish Ladd, who's done some videos. Harish, do you want to take over from here? And we'll get back to James, and I will share his slides.
So,
can you hear me?
I can indeed. Go for it. You've got some really wonderful things you want to share with us. And
So, good afternoon. Thank you for inviting me. My name is Harish Ladd. I'm a consultant intensive care in England, and I'm the clinical lead for organ donation in my hospital in Hull, which is a big city about halfway up the country on the east coast. My project, I need to share screen. Can you see that?
Yes, I can see the YouTube there. I'll let you take it from there.
This is the project that I've been doing, which you can find on the YouTube page for the Commonwealth Tribute to Life. And it's all these videos here which show the same man and the same video, but all in different languages. And this project was our national project in Britain, Leave Them Certain, where we were encouraged, families were encouraged to talk to their loved ones. What do you want to do about donation? So that if you ever came to that scenario, and the family was asked, the family knew. Sorry, I'm on duty today. And the idea came about after I got the job as the clinical lead because of essentially where I'm from, my original ethnicity. I mean, where I live in Britain, it's a very leafy white suburb, predominantly white population, where I'm the ethnic minority, which is, sorry about that. But where I've come from is a completely different place. Sorry, 1 second.
If you need to go for that, Harish, you can.
I don't. Say again.
If you need to leave for it, that's
no.
okay.
I have others to go for me.
Okay, we'll leave it to you then.
Where I come from in Bradford, that's very predominantly South Asian population, Pakistani, Indian, European, multiple languages spoken. A lot of people don't speak English, and that's the upbringing that I had, which is completely different to where I live now. When I got this job, I saw that Leave Them Certain advert on the TV and thought, do we need to try and promote this amongst the communities that don't necessarily speak English? Because that advert on TV was in English. This is a language map of Britain, and you can see that Asian, Black, other mixed
are predominantly concentrated in certain areas. London there at the bottom, and on the left side of the picture, that's predominantly big cities like Manchester, Leeds, Bradford, Birmingham. That's where the language
Sorry,
issues.
Harish, we've only got, like, we're having all this problem. All we haven't moved on. All we can see is the YouTube front screen with the Leeds Research
hang on.
videos.
1 second. New share. Is it this one?
No.
That one.
Oh, yes, it is that one, but just got to launch the talk.
Okay. I won't go through what I've done already.
No, just carry on. Yeah.
Essentially, in England, lots of different regions, multiple languages are spoken. There are large amounts of population that don't speak English as their first language. Can be quite a problem in a lot of our hospitals, and that's a list of a lot of the languages that are spoken. South Asian languages are predominant, along with the European ones. Again, our national data shows that the majority is English, but those are the predominant languages where if you don't speak English. Why this is important? Because in communities like my own, I'm Indian by origin, the consent rates for donation are half that of the white population. But we also predominantly are overrepresented as needing organs. As an Indian, I know that I have a predilection for diabetes, for renal failure, for hypertension. I may need a kidney in the future. I will do better with an Indian one. But families, they don't talk about the subject. They don't consent. It is the second commonest reason for refusing donation is the family don't know what their loved one would have wanted. And so because of that, after watching this, leave them certain advert on the television, my idea was to see, can we get this advert into the community where the first language is not English. What I did was to get people who spoke other languages, and these are the languages that I managed to find amongst friends, family, colleagues here in the hospital. They translated the audio of that advert you can see on the YouTube page into these languages. They sent the file back to me, and I turned them into a video. I burned the subtitles onto the video, and I'll just play a few seconds.
I remember Dad's dance moves
to see what it looks like.
It's killer, Tash.
So you can see
Dad was just a really happy character.
The Hindi subtitles appearing on the bottom. So I'm very grateful to all the people that were involved in giving me the translation to make these videos. My hope was that this video can then be used to target those communities to at least get the discussions rolling about donation.
I remember Dad's dance moves.
Skip that one. I'm always willing to keep going with the languages. The process isn't difficult anymore. It was at the very beginning, about 5 different pieces of software needed to put the subtitles onto the video. But I need more languages and I can make more videos. Malay, for example, is quite predominant here, and Tamil is one that I am missing. If it's not too bold of me to ask, the other thing I do need to do with all of these videos, as you've noticed, the audio was in English, the language was in a different language. I do need audio in any of those languages, so I don't know if anybody would be willing to help to potentially provide me with an audio file, and I can try and burn them onto the videos, to then I can have a video with audio and subtitles matching to be more accessible. I think that's it.
That's a really Mohan Foundation can try with Tamil, Hemal suggesting in our Zoom chat. That's fantastic, Harrison. We make all this effort we go into, making, that was like a TV advert we made in the UK by NHS Blood and Transplant. And sometimes, some audiences miss out, and rather, we talked already in this session about not reinventing the wheel is the way of sharing that and making one piece of work generate a lot of more outcomes and reach a lot more people. And I really just want to highlight now that actually we have a huge playlist on the YouTube channel you're all watching on for Leave Them Certain. And if you wanted to use any of them, you can use to share the message about organ donation and transplantation. So thank you, Harish, and thank you for joining from your on call today. I'm now going to launch back to James. So sorry about the IT problem just before. I am launching this, and I will ask a question of Satya. Is that full screen or is that presenter mode? Or James can tell me.
Yes, that is full screen.
Okay, that's fine. Over to you, James, then, and sorry about that interruption before.
Well, thanks, and sorry for my incompetence. I speak on behalf of Transplant Sport. Next slide, please. Next slide. This is a UK-wide charity whose goal is primarily to increase the well-being among transplant recipients through exercise, celebrate organ donation and transplantation, provide a support forum to support not only the recipients but their families, and particularly with children, and also we involve the donor families. It's also, which is why I think I'm talking today, is a superb opportunity to promote organ donation. I would stress that one of our key aspects is to work closely with NHS Blood and Transplant. We also work closely with the Donor Family Network, which represents donor families, and also on the international scale with other games organizations and patient charities. Next slide, please. The most recent games were held at the end of last year in Leeds. And next slide, please. And as you can see, it not only attracts a great number of competitors, over 2,000, and relatives, but also a lot of children. And I'd like to say that it benefits economically the town where we hold it. It brings in 8,000 bed nights, and using the standard approaches, it has an impact of over £2 million to the local economy. So when we're engaging with cities to host the games, again, please remember that it benefits the city as well as organ donation and transplantation. Next slide, please. It's a great opportunity for media coverage, and we work very closely not only with NHSBT media, we have our own press outlets, and they really like the individual stories and promoting people who've done well with organ transplantation, occasionally where donor families have met the recipients. All those things can be used by the media. They love it to promote organ donation. Next slide, please. And as you will see, we use advertising locally, and you can see that not only do we attracted 92 pieces of coverage in the media, our total reach, and I find this a hard figure to believe, but it's 3.3 billion was the total reach of coverage, advertising and social media. So there's enormous potential for these good news stories to get out there and promote organ donation. Next slide, please. Another feature that was developed this year, the suggestion of Roger Burnley, now a trustee, who was then chairman of the local organising committee, was a specific Yorkshire organ donation card. For those who don't know Yorkshire people, they're very proud of their beautiful county, and there's a great sense of belonging. So again, with NHS Blood and Transplant, we used our own organ donation cards, and over 10,000 have been issued. They continue to be used, and we hope that this will provide a legacy and a reminder about the importance of organ donation and having those discussions. Next slide, please. Again, just shows a bit of advertising. The air ambulance can show that promote organ donation, promote the organ donation card. Next slide, please. We've had the International Transplant Games, which are going with great success in Australia, and the UK has a good team representing the country there. Next slide, please. And we've also this year in Oxford held the European Transplant and Dialysis Games. Again, the international ones, the UK ones, and the European Games, all great opportunities not only to help the donor families, to help the recipients, but to raise the profile of organ donation. Next slide, please. Perth is the destination for 2023, and I know many countries are represented. I think the international games are much more competitive. The UK games tend to be more encouraging participation. But again, great opportunities not only to benefit the patients and the donor families, but also organ donation. I think that's the final slide, you'll be pleased to know. Yeah, so thanks for your attention and thanks for the invitation.
No, thank you, James. I think it's fantastic. We're seeing like how sport is another thing that brings people together and it gives you an excuse to get out into the communities and to really make an impact. So before I hand over to Dr. Satya Sharma for the final words, just a thanks from me for all our speakers today. I hope you've enjoyed this celebratory event, and we're going to sort of divide up some of the sessions into YouTube. Please share with people. Special thanks to everyone who got up early. Peggy, looking at you, joining us from Canada at 3 o'clock in the morning. This is a fantastic thing. We're only small yet, this community, but we do hope it's a 5-year memorandum to really build it and build it and build it. And so we can all learn from each other. And a special final thanks to me to Osahon Enabulele for giving us his keynote lecture today. But over to you, Satya, for the final words.
Thank you, Dale. And I must start with thanking you first, Dale, because you have done immense amount of work, not only for the initiation of the project, but also for carrying on in the last 12 months. And I know your enthusiasm will see us through for next 4 years as well. So thank you very much for all your hard work. And today's webinar would have happened if you had not put such an amount of effort along with Keelan in preparatory time, which I know you both have worked very, very hard. My plea to all of you would be to save the Commonwealth Day, which is once a year only. But if we can save Commonwealth Day, we can have a bigger participation. And I think it will be key to success for taking the ideas forward. So what is the way forward then? The first thing is that we must carry on with implementation groups, because implementation groups are the keys to success. If you want to walk longer, go in teams. If you want to walk faster, go alone. I suggest we go longer and work in teams. We have had an experience of MOU, which was a success between Mohan Foundation and NHSBT. And that success was purely because of implementation group. I have said to every single person who came on board about implementation group creation. It doesn't seem to have happened yet because it's only 12 months gone, but I think this is the time really to take a serious note of this. And I would also urge the coordinators to lead by example in creation of implementation groups. We have so far kept away from giving any guidelines because each country will have its own needs and its own way of creating implementation groups. But we certainly have got some ideas. If you want to talk to us, feel free. The other thing is about the ownership, which I mentioned in the beginning. And the frank admission is that it's not UK project. It is a project for all of us. All of us are on a round table, sitting and collaborating, coordinating, and pushing our weight equally to make this project a success. The last thing which I'd like to say is that when the coordinators do work, my request to them would be that they have activities within their own region, because there are so many dissimilarities between each region. For example, what Africa does is not necessarily duplicated in Australia, And what Australia does is not necessarily duplicated in Caribbean countries. So we all have our own needs, but if the coordinators will take a lead in creating the teams and getting them together and having activities totally independent of the forum which we have, the larger implementation group, that will have a greater impact. This will also mean that you will be fulfilling the needs within your own regions, but then there is also a part of success which could be shared, and the cross-fertilization of ideas between one group and the other might be tremendously helpful. Singapore and India had two such examples today. I'm absolutely sure that many other countries could follow that lead of going into schools and doing the artworks which we have seen today. But these are the sort of examples. However, these examples are limitless. And my suggestion to you would be that when we meet next time in 1 year's time, we should have had a long list of successes which we have built upon and we have created. I've got no doubt in the ability of innovation which exists within this group, but I request you to cash upon those innovative capabilities so that all of us can benefit equally. Thank you very much for your time today. I'm very grateful to you, Dale, once again for creating this webinar. It has been a great success and it has given us lots of ideas to take further. I hope that the way forward would be given equal importance by all of us so that we can all be smiling in 12 months' time, having achieved so much more. Thank you.
Thank you, Satya. And wherever you are across the Commonwealth, whether it's morning, middle of the day or evening, let's all work together on this project and save lives across the Commonwealth through sharing knowledge and expertise in organ and tissue donation and transplantation. That's it from us. But more events later through the year. But don't forget, for 11th of March 2024 will be Commonwealth Day again.